Medications for opioid use disorders in correctional settings. Shifting the paradigm, creating a balanced correctional and rehabilitative approach. The Opioid Response Network is funded by SAMHSA to provide resources and technical assistance needed locally to address the opioid crisis. This video is part of a series to provide guidance on the implementation of medications for opioid use disorder in correctional facilities. Leading corrections and behavioral health experts present information on topics such as the use of medication, models of delivery, diversion, and linkages to care and community support. An interview with Brent Gibson, National Commission on Correctional Health Care.
Hi, my name is Brent Gibson, and I'm the Chief Health Officer for the National Commission on Correctional Health Care.
What is the mission of your organization?
Our organization works to promote quality in healthcare in our nation's jails and prisons.
When you meet the average person, what is their reaction to this mission?
It's important to realize that nowadays, jails and prisons are a part of our public health infrastructure, whether we want that or not. A large proportion of our population is incarcerated. We saw some of those numbers this morning, more than any other developed nation by a long shot. And for that reason alone, there's a lot of health care provided in jails and prisons. Our organizational mission is to assure that health care is done at some level of quality. I hesitate to say community standards because that's a tricky area to get into. But it's important to realize that people who are in jails or prisons are just like the rest of us. Any of us is one speeding ticket away from, being incarcerated briefly or some other thing. And so I think we want to remove the stigma that incarcerated persons are different kind of people subject to different health care. One thing we always emphasize is we work very hard to limit use of the word inmate, offender, prisoner. In the healthcare setting, everybody's a patient, whether they're inside or not. And I think that's an important level setter, if you will, for the work we do.
What are the challenges of treating opioid use disorders in a correctional setting?
Treatment of opiate use disorder in a correctional setting is very tough. It's tough for many reasons. Stigma is a huge part of that reason. There is a stigma that people who abuse drugs, or whether they're prescription drugs or street drugs, are they're the reason they are ill. It's a moral failing, if you will. I would say as a physician that many diseases are connected to choices, whether that's diabetes, high blood pressure, or something else. It's a little controversial, but I remember when Mickey Mantle got his liver, and I heard over and over again, how come that guy gets to have a liver when we know, there was an issue of alcohol abuse? But he got it, and then he died. Now, I'm not saying anything bad about baseball or any particular person, but the point is, we all make choices that affect our health care. And when we make poor choices, we often end up in jail or in prison. So that's not exactly what you asked. You asked about some of the challenges. So for one, there is a substantial regulatory burden on the medications we want to use. It's unique in medicine. As a physician, more or less, I can write whatever prescription I want if I'm an appropriately licensed person. However, if I want to treat substance abuse, there are all kinds of special things that have to be in place. And it really comes down to the use of a limited number of drugs and the approvals that are required for that. On the law enforcement and jail side, that's just an extra burden people don't want to deal with. So you have to kind of recap, you have the kind of the concern of the sort of moral failing issue. You have the administrative challenges with getting these medications used. You have the expense, and you also have lack of training in many places to know exactly how to treat these patients. It isn't necessarily more technically complicated than anything else we do as physicians, but if you haven't done it before, it's something you have to learn. So for all those reasons and many more, I haven't even touched on issues of diversion and sort of the culture of what it's like to be in jail. That all makes for this to be very, very challenging. I'll add one more complication, and that is as recently as when I trained in medical school, we were told that withdrawing from opiates was not something to worry about. You just kind of put people inside and treated their symptoms and hydrated them, and they'll get through it. Now, keeping somebody from dying is not the same thing as treating them. And that's at best in our jails, we're keeping them from dying. And we're, as you can see in the news, we're not even doing that very well. So those are some things to think about.
How is the quality of treatment nationally?
First and foremost, I never want to criticize anybody who's making efforts to fix this problem at any level, whether that's research or that's happening at a state level. This is all good. But from the national perspective, the information and the research and the know-how doesn't penetrate down to the county level, which is really where the action is, so to speak. What's where the biggest public health impact, that's where a big public health impact can be. So that's where we come in. We are literally in every state but a couple. We have at least one accredited program almost everywhere. And all in all, about 500 facilities, as well as thousands of other people that come to our conferences and so forth. So the point is, there has to be technical information distributed, and there has to be culture change, and there has to be a supportive legal framework. You need, for example, an elected sheriff who is supportive of the jail treating these patients. And if you had to pick a most common scenario, County X will have an elected sheriff and an appointed supervisor of the jail. There's all kinds of different models, but all of those pieces have to be aligned to get the programs, the treatment done appropriately. So I come from the military where we're used to treating patients in an austere environment. That means you kind of make do with you have to work with what you have in the situation. And jails and prisons in many ways are an austere environment.
How urgent is the problem of opioid use?
This is a real urgency. I would say if one life is in danger somewhere, there's an urgency. As a physician, every life is precious, and we work to conserve that. And I'm certain that people are dying weekly, if not daily, in our nation's jails and prisons from all kinds of things. And one way we can reduce that risk is by having proper treatment for those with opioid use disorder in the smallest jails and the largest jails, wherever it needs to be.
Does stigma impact the treatment of opioid use disorder?
I think we need to view substance use disorder and related conditions like we view any other thing that we need to treat. We tend to, I think, as a culture, look to assign blame. And accountability is appropriate. Blame is less helpful. So if I'm injured in a car accident and I wasn't wearing a seatbelt, a certain number of people will say, well, it's not that he got what he deserved, but he could have made a better choice and buckled that seatbelt, right? So that's a common, or a bicycle helmet, or a motorcycle, whatever. Any of these preventive measures that are out there, people are going to stigmatize you if you make the wrong choice. So I don't know how else to say it. I will give you something else to think about. So I finished medical school in 2001, and as recently as those early years, there was an enormous emphasis placed on asking about pain as the fifth vital sign. We were harassed and berated for not exploring pain. So as physicians, we're going to try to accommodate that. And what's the most common way to treat pain? One of the easiest things to do, I should say, is to write a prescription for a pain medication, almost always an opioid, sometimes an NSAID. But some of the problem we're facing now as a nation comes from prescribing practices and sort of treatment expectations of the last 20 years. That's not everything, but that's a real part of the challenge. But the pendulum can go way back the other way, and nobody's going to be treated for pain, and that's going to be a problem too. And if you live long enough, you see cycles and everything. And so, I just distinctly remember, even as when I had my wisdom teeth extracted, and I was written a prescription for Tylenol number 3, and I think it was like 6 pills or something. And when those were over, I went to ask for more, and the dentist gave me the, you don't need any more kind of thing. So this, it's like there's that there's that going on too. I mean, this probably isn't particularly helpful commentary, but we're where we are for a variety of reasons. And the important thing is, how do we dig ourselves out of this?
Do individuals receive sufficient continuity of care upon re-entry?
The vast majority of people are incarcerated for a pretty brief portion of their lives. So they're going to get back into society. And the treatment that starts in the jail, if it starts, is going to need to be continued in the community. And the community resources are not sufficient to meet that need right now. And as a hypothetical, you may have a jail that does everything perfectly and treats all of its patients, but those patients are going to be released. And if they go into the community or to a prison without the right systems in place and providers in place to provide that continuity, they're not being well served. Again, think about diabetes, hypertension, or any other number of chronic diseases. You have to be able to manage those at all stages of this corrections life cycle, if you will. And many people cycle back and forth with the jails.
Is there anything else you would like to share?
I think it's important to touch on the three takeaway points: that substance use disorder is a treatable chronic brain disease, and we need to think about it like that, not a moral failing and isolation of everything else. And treatment should be individualized, and individual treatment is challenging. Individual anything is challenging in a correctional environment, but you can't treat patients all the same. And finally, the correctional world, whether it's a jail or a prison, is really a great place, an appropriate place to initiate or maintain treatment. It's really an imperative. And how we go from where we are now to an end state where these options are available, I think is the focus now.
Technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorder. To request technical assistance, visit opioidresponsenetwork.org.